Hey everyone, hope you're doing well. I'm a little sick, so bear with me. Gonna go ahead and start. Okay, so how I research procedures, basically some of these are straightforward. Most of them actually are things that I've seen before, but if they're not, I will kind of Google the name of the procedure, or if I can't figure out the name, if it's not stated in there, I'll just kind of type in some of the keywords and see if I can figure out what kind of procedure it is. And then I pick out everything that's needed to code it and look further into it if I can't find everything at once. So I might have to do a couple Google searches for some things, but for these, they seem pretty straightforward. Anything that I do have to research, I'll put the link beside of it. So for all of the cases that come from the Understanding ICD-10-CM and ICD-10-PCS textbook on Cengage, a lot of these are from Chapter 28, but there's some others in here as well. This is case study 1, and it's a 10-year-old male who presents with wrist pain. He was riding a skateboard and he hit a crack on the sidewalk and fell forward. And let's see, no loss of consciousness, no vomiting, abdominal pain, or dizziness. So he had an x-ray done, and it revealed a dislocation of the right wrist. Closed reduction of the distal radial ulnar joint was performed. And now the bones are in place after that follow-up x-ray. So most of this you don't even need. I've highlighted what I used. So go over here and do reduction, and it gives you a list of things. I chose dislocation and joint, wrist, right. And that gives you the first 4. That's an external approach, and there was no device or qualifier. Okay. Case study 2, that's from the same chapter. It's a 21-year-old female who came for removal of an impacted molar on the lower left side. So they got the tooth out. It says intervention is needed to get the tooth out. So that procedure was to remove a tooth. And since it says removal of a tooth, I use resection rather than excision because the whole tooth is being removed. So we'll start with resection. Tooth. Lower. And that gives you most of it right here. And it's just one tooth, so single. Okay. Next I did from the same chapter, case 4, and diagnosis hydrocele under general anesthesia, prepped and draped. Let's see, a 3.5 centimeter incision was made in the left scrotum, and a hydrocele was visualized. Hemostasis was achieved. The hydrocele was located in the tunica vaginalis and was dissected and brought through the incision site. Hydrocele was surgically excised, drain was placed. The wound was closed in layers. So that led me to believe that that's an open approach. So first I looked up hydrocelectomy, and it comes up with C-excision male reproductive system, first 3. And over here it mentions, the tunica vaginalis left. And like I said, open, and it's not diagnostic, so there's no qualifier for that one. Moving on to the next is the same chapter, case 5. Let's see. 64-year-old female was taken to the OR and placed in supine position. Upper midline incision was made and retractors were placed. Some of this info leads me to believe open because wound was closed in layers, deep layers, and it says entire spleen was removed, so that's a resection, not an excision. So I'm going to look up splenectomy and excision, resection, not excision. And it's the spleen, open, and no qualifier. No complications. So nothing else. Same chapter, case 7. So orbital lesion, left eye. Let's see, left orbit. Lesion was clamped and excised. So I got excision because it's a lesion. You're not doing the whole thing. You're just removing the lesion. So that's an excision. Orbit, left. That gives you the beginning of the code. Let's see. Yeah, so that's open approach for that as well. And no device and no qualifier. Okay, same chapter, case 8. I'd already got this far before I realized I'd already had an impacted molar case, but I'd already done everything for it, so I decided to keep it because it is just a little bit different. Impacted upper molar and removed in whole. It does say the soft tissue was dissected to expose the impacted tooth, and it was able to be removed in whole. 2 sutures were placed. So resection, tooth, upper, and that gives you most of the code. It's open approach. You don't have to do anything with that, and single. Same chapter, case 10. Talking about a left breast mass here. Basically, it's diagnostic. They're doing a biopsy, prepped and draped in the normal sterile fashion. A 3 centimeter long incision was made in the upper portion of the breast. Dissection was carried down to remove tissue, and biopsy was taken. So this is excision. You're not removing the whole breast. You're doing an excision on part of it. So excision. I think I did that backwards. Excision, breast, left. So this right here is flip-flopped. It's supposed to be excision, breast, left. And then that leads you to the first 4. And it's a percutaneous approach. I was kind of back and forth between percutaneous and open, but it's a minor incision, so I decided to go with percutaneous. No device, and diagnostic because biopsy was taken. Okay. This is from chapter 35, and this is case 1. It's in the same book. Presents with diagnosis of Kaposi sarcoma, lungs, and the diaphragm. The patient will be receiving 2 separate treatments, and it's radiation therapy. This is the lung with mets to the diaphragm, and this one was pretty straightforward, but I did look up the Kaposi sarcoma just for a bit of refresh. I did put the link here for that one as well, so that if you needed to look back, you can. So beam radiation is the operation, and it's delivered to each area. First the lungs, and then the diaphragm. So we'll start with the lungs. Beam radiation, lung, right here, and it says 20 photons, so it's greater than 10, no isotope, and no qualifier. And it's basically the same. You can just scroll up right here to diaphragm because it's in the same. And right here, same thing. It's greater than 10. No isotope and no qualifier. So that's how you get the second code. And you do have to code both because it says each area, first the lungs, then the diaphragm. And then I went to chapter 36, case 1, and just to get something different in here, this is an 81-year-old female who had a CVA 3 weeks ago. She's here for a speech assessment. So it was a testing for receptive and expressive language function. So it literally says assessment, and it's testing. So it's not therapy, it's an assessment. So we're going to look up speech assessment. It gives you the first little bit, and it's none. And for this, it says receptive and expressive language, because it says it right here. And there's no qualifier. There's no equipment used for that. No equipment and no qualifier. Excuse me. This is chapter 36, case 2. And for this one, I honestly couldn't remember at all what to look up to find this. I typed a few things in and couldn't figure it out. So I basically looked up what is an assessment to determine one's ability to get his clothes on unassisted. And this article from NCBI come up and mention activities of daily living. And when you look that up, it comes up either assessment or treatment. And this is an assessment because you're trying to assess if he will be able to live at home and function normally. Body system, none. And let's see, groom. He wants to be able to groom and dress himself. So grooming and personal hygiene. Oh wait, no, for that one. Groom and dress is assessing his ability to get his clothes on unassisted. So no, dressing. That's where it can get a little tricky because it did say groom, but he needs to be able to dress himself before he can go home. There's no equipment used for that and no qualifier. I did put the link here just so you can see where I had to look up about what to search up for this one. And that's it. Most of these were pretty straightforward, just a little bit of research. I know they're not all going to be that easy, but these are just the ones that I found in the book. I tried to find longer cases instead of some of the shorter ones I was seeing, so just to give a little bit of something different. Let's see. I'll go ahead and exit out of all this, and thank you for your time.